Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health. When it's August in New Orleans, so long as there's no tropical weather, I guess less miserable is about all you can ask for.
Yeah, and a cold front's even better.
Yeah, well, again, my name's Thomas. I'll believe it when I see it. I was appropriately named. Dr. Brent Wallis, People's Health, Vice President of Clinical Integration, is our guest. We're going to talk about colon cancer and the importance of screenings today. According to the American Cancer Society, colon cancer is the third most common cancer among men and women in the United States. And I would think part of that might be hesitancy to talk about it, but you know who is most at risk and what causes colon cancer? Probably not, but Dr. B does, Dr. Brent Wallis from People's Health, and he is going to answer those questions and talk about the importance of getting screened for colon cancer. Doc, I understand colon cancer is common, but is it true that it is also very easy to detect?
Yes, definitely, and that's what's so important. It's a very highly detectable cancer, but finding it early is really the key to preventing it. And Louisiana has one of the highest death rates in the country from colon cancer, which is mostly due to either inadequate or late screening for the cancer.
Does I'm trying to think what the proper word would be, hesitancy to talk about it, or I hate to say stigma, but obviously cancer has a stigma, but you understand what I'm saying, where people are hesitant to even delve into that area of their health?
Yeah, I think that plays a little bit into it. I think the other thing is kind of a misunderstanding of what the screening process is and a little bit of fear around that screening process as well.
But it is preventable.
Yeah, that's what's really exciting. It's preventable, it's treatable, and it's curable. But again, you have to catch it early. And a lot of people wait too late to get checked, and then they're diagnosed with a more advanced stage cancer. Another thing to keep in mind right now, because of COVID-19 and isolation and, a reduction in visits to your primary care physician, there's been a severe decline in the screening rates. And so that's why it's important, even during this pandemic time, to keep up with your yearly screenings, your doctor's appointments, and your vaccinations. And, one thing to kind of watch out for, many of the health systems and health plans locally, like People's Health, are even sending out testing kits to patients in order to screen for colon cancer. That's how important it is. So if you get one of those in the mail, you should definitely do it.
You said once a year, I guess. How often should you get screened for colon cancer?
Yeah, so it depends a little bit based on the screening test you're going to do, but in particular, you start screening after you turn age 50. And then you need to get re-screened at regular intervals, which is really going to be based on your doctor's recommendation. And like I said, depending on the type of screening test that you get done. And then if you have some particular risk factors or you're higher risk because of other conditions you may have, they may actually ask you to get tested before age 50. So talk to your doctor about the specific screening protocol that you fall into.
Let me say at this juncture, we have our mortgage financial phone and text line at 504-260-1870. So if you have any questions or comments for Dr. B as it relates to colon cancer screening, what have you, please feel free to text them in, and I'll pass them along to the doctor, and he can answer them. Doctor, in terms of insurance, do insurances cover this? Is this something that people have to worry about from an expense standpoint?
No, all insurance carriers, including Medicare and Medicaid, cover screening tests like this. And so occasionally there's a small copay associated with some of the diagnostic testing, but for pure screening with a colonoscopy, or sometimes we do a stool test, there's no charge for that. So there's really no financial reason to not get it done.
And it makes sense from the insurance company's standpoint, too. Not only is it easier for you for WellCare, whatever you call it, or preventative checks, but it's a lot cheaper for them to look at the business part of it if God forbid you get it. Who is at risk for colon cancer, generally speaking?
So like I said, age is really the number one risk factor. So as people get older, particularly after 50, that's where we start to see colon cancer. In fact, about 90% of the cases are in patient over the age of 50. But in particular, too, we see a higher incidence in African American patients, Eastern Europeans, and then also anybody with family history of colon cancer, because it does run in families. And then, some other factors you can't necessarily control. Patients who have inflammatory bowel diseases, things like Crohn's disease and ulcerative colitis, have a higher risk. And then also people who have had other types of cancers, like breast or ovarian or uterine cancer, can have a higher incidence of colon cancer as well.
We'll take a quick break. I'll give you a true-false question. The audience is a pretty simple one, but I'll put it out there and we'll answer it when we come back. Does smoking contribute to the risk of colon cancer? You can figure out the answer for yourself, or at least decide what you think it is, and then we'll tell you definitively when we return. It's 8:20. We're talking to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. Senior Health, if you are a senior or the son or daughter of a senior, we're talking about colon cancer and the risks involved. Time for traffic now, WWL. 8:25 now, WWL. I'm Tommy Tucker. It's Thursday morning, August the 13th, and we're talking to Dr. B, Dr. Brent Wallis. Normally on Thursdays at this time. He's the Chief Medical Officer of People's Health. And we're talking about senior health, and today specifically colon cancer. If you're a senior or even the son or daughter of a senior, we want everybody to be happy and healthy and safe and well, right? Well, I gave you an easy true or false before the break. I said true or false, that does smoking contribute to the risk of colon cancer? And Dr. B, it'd be kind of hard to get this one wrong, huh?
Yeah, definitely. That's definitely true. And smoking is a very controllable risk factor that affects a lot of health conditions, but does actually increase your risk for colon cancer. In addition to that, too, consuming a lot of alcohol can actually lead to higher rates of colon cancer. And then also a diet that's real high in red meats or processed meats, which can lead to being overweight or obese or having a sedentary lifestyle, and that all of those can actually add to your risk for developing colon cancer.
Let me throw in a listener question here, if I can, about smoked meats, barbecued meat, bacon, etc.
Yeah, those fall into kind of the processed meat category, and those definitely have been found to increase the risk of colon cancer as well as a couple of other types of cancer. So, moderation is always the key if you're going to indulge in something like that.
Are there always symptoms that'll warn you that colon cancer is present or you have a problem?
No, and that's why it's so important to get screened, because quite often, especially at the early stages of colon cancer, there are no symptoms at all. When the disease progresses and if the tumors actually get larger, usually the first thing you'll see is a change in your bowel habits. So really, you should call your doctor right away if you have any nausea or vomiting, changes in your stool, cramping, and then really especially weight loss. Unless you're trying to lose weight, most adults should not lose weight, for no reason. And so if you're losing weight, you should reach out to your doctor right away.
And let me work a text in here, if I may. Is there any correlation between how often you go to the bathroom and risk for colon cancer?
No, not necessarily. That can be more related to diet and really something more personal to people. So the frequency itself is not a major concern, but really loose stools or like I said, change in the type of stool is something more concerning you want to talk about.
Let's talk about diets. A bad diet does increase your risk?
Yeah, definitely. Like I mentioned, the red meats can definitely increase the risk for colon cancer. But what's great is there's actually a lot of foods that you can eat that are more protective and actually help reduce your risk of colon cancer. Any foods that are high in fiber are usually better for you. So fruits and vegetables are very good. So working those into your diet is very important. And really staying active and maintaining a healthy weight is really important as well. And that will help you with other health conditions such as your cholesterol and your blood pressure. And then, like we just said, don't smoke. And if you do smoke, you need to quit.
So many times it comes down to the same thing, huh, Doc? Eat healthy, stay active, don't smoke, and keep your weight down. Real quick, a text, if I can work it in. Somebody texted in and said, I'm 42, but my uncle had colon cancer. Is it too early to get screened?
You should talk to your doctor about that because it really depends on when your uncle was diagnosed with colon cancer. So if a parent is diagnosed much later in life in their 70s or 80s, you may not need to be screened until age 50. But if they were younger, then your doctor may suggest that you get screened because that means you may have a family history of a little bit more aggressive type of cancer.
Thank you, Doctor. I appreciate your time as always. We'll talk to you next Thursday. Have a great weekend, all right?
Thanks, Tommy. You too.
And if you want to find out more about People's Health, you can always go to peopleshealth.com. You can call 855-821-2666. And you can follow People's Health on Facebook, Twitter, and Instagram. It is your one-stop resource for seniors and grown children of seniors to navigate their way and your way through the choppy waters of senior health care. Quick break in your health care. Quick break in your health care. Quick break in your